I started out with a chronic pain condition. They switched me to narcotic pain medication, and that just took on a life of its own. I never thought in a million years that I would be living on the streets, addicted to pain medication, and then move on to heroin.
In the 1990s, there was a major push to treat pain. Pain was considered the fifth vital sign. There was little understanding then about the addictive nature of long-term opioid use.
Opiates use disorder is a medical condition. It involves changes to the brain that make it very difficult at times to get off the medication. It's estimated in the United States that every 18 minutes an American dies from an opiate-induced overdose. The number of people that die from overdose now exceeds that from motor vehicle accidents as well as from firearm homicide. This is not a condition, that you can just take care of in a 30-day, stay. It's a chronic condition. There are a group of drugs that fit under a category called Medication-Assisted Treatment, or MAT. Drugs that really interact with some receptors in your brain to reduce the craving and the withdrawal.
With the cravings gone, the withdrawal symptoms gone, patients can focus on their recovery. Our experience is in line with the medical literature that patients do far better in their recovery when they use medication-assisted treatment. They are far less likely to die from an overdose, and we have to remember that this is a disease that kills.
Optum is really looking closely at the rise of substance use disorder, and to tackle that, we need to really expand our medication-assisted treatment network. Over the past couple of years, we've grown that network from about 2,000 locations to nearly 5,000 locations. We use heat maps to identify where members live that have had a history of substance use disorder and use that to target where we need to recruit new providers.
Clean Slate is the largest provider of office-based opioid treatment services in the country. We're really proud to be in partnership with the Optum organization that has been very progressive and innovative in terms of providing new services to patients.
MAT is not just the medication, it's also counseling, and ideally there's a third component, the use of peers or recovery coaches.
The stigma about using medication-based addiction treatment is a very troubling misconception. People use drugs for the euphoric effect that it causes. The high. Patients do not get high from the medication that we prescribe.
I almost didn't make it here. I was, just one bad shot away from death. And now I am in medication-assisted treatment, which has helped tremendously. I have 2 wonderful children. I'm able to volunteer and go to school, and none of that would have been possible without the medication-assisted treatment program. Absolutely would not be possible. We finally have a future, and that's nice to have.